What if I told you that right now, at this very moment, your heart could be sending you a distress signal and you wouldn't even know it? What if the signs were so quiet, so easy to dismiss, so perfectly disguised as just getting older, that you brushed them off every single day without a second thought? And what if missing those signs cost you everything? I need you to stop what you're doing. I need you to really listen to what I'm about to share with you, because this is not just another health video. This is the conversation that could literally be the difference between you watching the sunrise tomorrow morning or someone else having to make a very difficult phone call. I have seen this happen. Doctors have seen this happen. Families have lived through this, and they all say the same thing afterward. We had no idea. There were signs, but we just didn't know what to look for. Today, I am going to change that for you. We are talking about the 5 silent heart warning signs that are most dangerous for people over the age of 70. And I want to be very clear. The word silent here is not an exaggeration. These are not the dramatic chest-clutching Hollywood heart attack moments. These are the whispers, the subtle changes, the things your body has been trying to tell you for weeks, maybe months, maybe even years, that most people, and even some doctors, mistake for normal aging. But here is the truth that nobody talks about enough. Normal aging in a heart in crisis can look frighteningly similar from the outside. That confusion kills people. And I refuse to let that be your story. So let's begin. Let's go deep. And let's make sure that by the time this video ends, you know exactly what to watch for, what to do about it, and how to protect the most important muscle in your body. Because every single beat of your heart is a gift, and you deserve to know when that gift is in danger. First, I want you to understand something fundamental about the heart after 70. The cardiovascular system has been working non-stop for 7 decades or more. 7 decades of pumping, pushing, regulating, adapting. The heart muscle itself changes. It becomes slightly stiffer. The walls thicken. The electrical system slows down just a little. Blood vessels lose some of their elasticity. These are natural changes, yes, but they also mean that when something starts to go wrong, the warning signs look completely different than they do in a 50-year-old or a 40-year-old. A 40-year-old having a heart attack often feels crushing chest pain so severe they can't ignore it. A 75-year-old woman having the exact same cardiac event might just feel a little more tired than usual. She might think she slept poorly. She might think she's coming down with something. She might wait, and waiting in those moments can cost her life. This is what cardiologists call atypical presentation. And it is far more common in older adults, particularly older women, than most people realize. The heart is in trouble, but the body's alarm system has changed. The bells are still ringing. They're just quieter. And if you don't know what to listen for, you'll sleep right through them. So let's talk about the first silent warning sign. And this one surprises people every single time I bring it up. Fatigue. Not the kind of tired you feel after a long day in the garden or after chasing your grandchildren around the yard. I'm talking about a deep, persistent, unexplained exhaustion that settles into your bones and doesn't go away with rest. You sleep 8 hours and wake up feeling like you haven't slept at all. You sit down in the afternoon and the idea of getting back up feels overwhelming. Simple tasks, cooking a meal, walking to the mailbox, climbing the stairs, start to feel like enormous efforts that leave you breathless and drained. Now, I know what you're thinking. That's just getting old. And I understand why you'd think that. Society has told us for so long that fatigue is just a normal part of aging that we've stopped questioning it. But here is what the research actually shows. When the heart is not pumping efficiently, when blood flow is compromised, the body begins to ration its energy. Your vital organs get priority, and your muscles and peripheral tissues get less. The result? A profound bone-deep tiredness that no amount of sleep can fix. This is your heart saying, "I'm struggling to keep up." The key distinction here is change. If you've always needed an afternoon nap and you still need an afternoon nap, that's probably not a cardiac red flag. But if a person who used to have the energy to do their shopping, visit friends, and prepare meals is now exhausted after a single task, that change matters. That shift in your baseline energy level is your body waving a flag. Please don't ignore it. What makes this sign so dangerous is that it creeps in gradually. It doesn't arrive overnight with a dramatic announcement. It tiptoes in over weeks and months, and by the time you notice it, your heart may have been struggling for quite some time. Studies have shown that many heart attack patients, when asked afterward, report experiencing unusual fatigue in the days, weeks, and even months leading up to the event. They thought they were just tired. They thought they needed more vitamins. They thought it was stress. If you or someone you love has been experiencing this kind of unexplained, persistent exhaustion, please don't brush it off. Talk to a doctor. Get a proper evaluation. Ask for an electrocardiogram. Ask about heart function. Ask about blood flow. Because catching a problem early, when the heart is struggling but still functioning, is an entirely different situation than catching it in the middle of a crisis. Now, let's talk about the second silent warning sign. And this one is one that so many older adults experience, but rarely connect to their heart. Shortness of breath during activities that never used to wind you. There's a difference between being slightly out of breath after climbing several flights of stairs and finding that a single flight, or even just walking from one room to another, leaves you needing to pause and catch your breath. There's a difference between getting a little winded during exercise and waking up in the middle of the night gasping for air, needing to sit up or open a window just to breathe comfortably. That second scenario, that breathlessness that comes too easily, too often, or that wakes you from sleep, can be a sign of something called heart failure, or it can be an early indicator that the heart is not managing fluid properly. When the heart's pumping action weakens, fluid can back up into the lungs. The medical term is pulmonary congestion, and it feels exactly like what it sounds, like your chest is heavy, like breathing requires effort, like you can't quite get a full, satisfying breath. Many people over 70 are told that their breathlessness is due to being out of shape or to other conditions like asthma or COPD. And while those conditions are real, they should never be assumed without first ruling out a cardiac cause, because the treatment for a lung problem and the treatment for a heart problem are very different, and getting that distinction wrong is genuinely dangerous. Here is a practical thing I want you to pay attention to: the position of your head when you sleep. People with early cardiac-related breathlessness often notice they start adding more pillows under their head without quite knowing why. It just feels more comfortable. What's actually happening is that lying completely flat makes the fluid redistribution in their lungs worse, and propping themselves up gives them slight relief. If you've started needing 2 or 3 pillows to sleep comfortably when you used to sleep flat, that detail matters. Tell your doctor. Write it down before your appointment so you don't forget to mention it. The third silent warning sign is one that many people laugh off or attribute to age, and I understand why, because it seems so benign. Swelling in the legs, ankles, and feet. We call this edema in medical terminology, and it happens when fluid accumulates in the lower extremities. Now, some degree of ankle swelling at the end of a long day, especially in warm weather, is indeed common and not necessarily dangerous. But there is a pattern of swelling that should make you sit up and pay very close attention. If your ankles and feet are consistently swollen when you wake up in the morning, before you've even been on them, that is not normal. If pressing your thumb into your shin or ankle leaves an indentation that takes several seconds to fill back in, that is a sign of significant fluid retention. If your shoes have started feeling tight on both feet at the same time, or if you've noticed that your socks leave deep, lasting marks around your ankles, these are signals that your body is not managing fluid the way it should. The heart and the kidneys work together in a delicate system to manage fluid balance in the body. When the heart isn't pumping strongly enough, pressure builds up in the veins and fluid leaks out into surrounding tissues. It tends to pool in the lowest points of the body, the ankles and feet when you're upright, the lower back and buttocks when you're lying down. What makes this particularly tricky is that leg swelling has many causes. Venous insufficiency, kidney problems, certain medications, including some blood pressure drugs, can all cause swelling. So the goal here is not to diagnose yourself, but to notice, to track, and to report. If your swelling is new, if it's getting worse over time, if it's accompanied by any of the other signs we've discussed, fatigue, breathlessness, sudden weight gain, the combination of those things together paints a picture that absolutely must be evaluated by a physician. In speaking of sudden weight gain, this is a sub-sign that belongs right alongside the swelling conversation. Cardiologists often tell patients with heart failure to weigh themselves every single morning at the same time, under the same conditions. Why? Because a gain of 2 or 3 pounds overnight or 5 pounds in a week is almost certainly not fat. It's fluid. And fluid accumulation that rapid means the heart is struggling to maintain its balance. It's a red alert that often precedes a hospitalization, and catching it early can make an enormous difference in outcomes. The fourth silent warning sign is one that I want to spend extra time on because it is perhaps the most misunderstood and the most frequently dismissed. It is heart palpitations, irregular heartbeat, or the sensation that your heart is fluttering, skipping, racing, or pounding in ways that feel different or unusual. Now, not every palpitation is dangerous. Occasional, brief sensations of the heart skipping a beat are extremely common and are often completely benign. But when palpitations become frequent, when they last more than a few seconds, when they're accompanied by dizziness or lightheadedness, when they wake you from sleep, or when they occur in someone over 70 with other risk factors, they deserve serious attention. The reason this matters so profoundly for older adults is a condition called atrial fibrillation, often shortened to AFib. Atrial fibrillation is the most common heart rhythm disorder in the world, and its prevalence skyrockets after the age of 65. By 75, a significant percentage of the population has AFib, and here is the terrifying part: many of them don't know it because it causes no obvious symptoms, or the symptoms it does cause are so vague and inconsistent that they get attributed to something else. Atrial fibrillation occurs when the upper chambers of the heart, the atria, begin firing electrical signals chaotically instead of in a controlled, rhythmic pattern. The heart beats irregularly, sometimes too fast, sometimes too slow. Blood doesn't flow through the chambers as smoothly as it should, and in those turbulent pockets of blood, clots can form. Those clots are the real danger. When a clot breaks loose from the heart, it travels through the bloodstream. And if it reaches the brain, the result is a stroke. People with untreated atrial fibrillation have a risk of stroke that is 5 times higher than the general population. 5 times. And strokes in older adults are frequently devastating, causing paralysis, speech loss, cognitive decline, or death. The insidious thing about AFib is that it often comes and goes. A person might feel completely normal for days or weeks, then have an episode of irregular rhythm that lasts hours and then resolves on its own. They feel better, and they think, well, whatever that was, it passed. But the clot that formed during that episode may not have. It may still be traveling. If you've ever noticed your heart beating irregularly, if you've ever felt it racing for no apparent reason, if you've ever felt dizzy or lightheaded in a way that came and went quickly, please get an EKG. Ask your doctor about a Holter monitor, which is a portable device that records your heart rhythm continuously for 24 to 48 hours. Ask about newer smartwatch technologies that can detect irregular rhythms, because catching AFib before it causes a stroke is one of the most powerful preventive steps an older adult can take. Treatment for AFib has come an extraordinarily long way. Blood thinners can dramatically reduce stroke risk. Medications can help control heart rate and rhythm. Procedures like cardioversion and ablation can, in many cases, restore normal rhythm entirely. There is hope here. There is intervention available, but only if you know the problem exists. The fifth silent warning sign is the one that I think is the most overlooked, the most surprising, and the one that breaks my heart the most when I think about how often it's missed. It is dizziness, lightheadedness, or unexplained fainting, especially when you stand up. When you stand up from a sitting or lying position, your cardiovascular system has to rapidly compensate for gravity pulling blood away from your brain. In a healthy, well-functioning cardiovascular system, this happens almost instantaneously. The blood vessels constrict, the heart rate adjusts, and blood pressure stays stable. But in an older adult whose heart is struggling, or who has arterial stiffness, or who is on certain medications, this compensatory mechanism can be slow or inadequate. The result is a sudden drop in blood pressure when standing, a condition called orthostatic hypotension. It causes a brief but sometimes intense sensation of the room spinning, of vision going gray or black at the edges, of feeling like you might faint. Many people grab onto something, a counter, a door frame, a piece of furniture, and wait a moment for it to pass. It does pass, and so they don't mention it to anyone. But this is critical. That momentary drop in blood flow to the brain is not just uncomfortable. It is a window into how your cardiovascular system is functioning. And in older adults, orthostatic hypotension is strongly associated with increased risk of falls, with cognitive decline, and with underlying heart disease. It is also associated with cardiac arrhythmias, including again that dangerous atrial fibrillation we just discussed. Beyond orthostatic hypotension, dizziness in an older adult can also signal that the heart is not delivering adequate blood flow to the brain on a consistent basis. Conditions like heart valve disease, particularly aortic stenosis, where the aortic valve narrows and restricts blood flow out of the heart, can cause dizziness, fainting, and what's sometimes described as a grayout during exertion. Aortic stenosis is a serious condition that is far more common in people over 70 than most people realize, and its symptoms, shortness of breath, chest tightness, dizziness, and fatigue, are all things that can easily be mistaken for aging. Fainting or syncope in an older adult should always be taken seriously. It should never be assumed to be benign without a proper cardiac evaluation, because sometimes a fainting episode is the only warning sign before a fatal arrhythmia, and getting a thorough evaluation after a fainting episode could be the decision that saves a life. Now, I want to talk about something that ties all 5 of these signs together, because understanding the connection between them is what makes this information so powerful. These 5 signs, unexplained fatigue, breathlessness, swelling, irregular heartbeat, and dizziness, are often not dramatic on their own. Each one, in isolation, has a seemingly reasonable, non-cardiac explanation. And that's exactly why the heart finds ways to give us multiple signals at once. It's trying to be heard through multiple channels, hoping that the combination will get our attention even when a single symptom doesn't. When you start to see these signs clustering together, when a person is more tired than usual and a bit more breathless and their ankles have been swelling, that cluster is meaningful. That pattern is your body speaking in a language that says something is happening here that needs attention. Please don't wait for a dramatic event to take that language seriously. I also want to speak directly about a heartbreaking reality in healthcare. Older adults, particularly older women, are statistically less likely to be taken seriously when they present with vague cardiac symptoms. They are more likely to be told it's anxiety, stress, or just aging. They are less likely to receive the same aggressive workup that a younger man with chest pain would receive. This is changing, awareness is growing, but it still happens, and that means older adults need to be their own advocates. Write your symptoms down before your appointment. Track when they happen, how long they last, and what makes them better or worse. Bring a family member or trusted friend who can support you and help communicate. If you feel dismissed, ask for a second opinion. Ask specifically for a referral to a cardiologist if you have multiple symptoms that concern you. Your instincts about your own body matter. Your decades of living in that body have given you a baseline that no doctor can fully replicate from a 15-minute appointment. Trust what you feel and keep pushing until you feel truly heard. Now let's talk about what you can actually do, because information without action is just a form of anxiety, and that's not what this is about. This is about empowerment. This is about giving you the tools to protect your heart starting today. The first and most important thing is to establish a relationship with a primary care physician and to be seen regularly. Blood pressure checks, cholesterol panels, blood sugar monitoring, and basic heart rhythm evaluation should be part of your routine care after 70E, not occasional events. Many of the underlying conditions that lead to heart failure, stroke, and arrhythmia, high blood pressure, diabetes, high cholesterol, are manageable when caught early and when treatment is consistent. Blood pressure control is, I cannot stress this enough, one of the most powerful tools available for protecting heart health in older adults. Chronically elevated blood pressure forces the heart to work harder, thickens the heart muscle in ways that reduce its efficiency, damages blood vessel walls, and dramatically increases the risk of both heart attack and stroke. And here is the painful truth. Millions of older adults have high blood pressure that is either undiagnosed or inadequately controlled. Many feel absolutely fine. Blood pressure earns its reputation as the silent killer because it causes no pain, no obvious symptoms until the damage is done. Know your numbers. Check your blood pressure at home, not just at the doctor's office. Blood pressure can spike with anxiety or stress in clinical settings. It's called white coat hypertension, and home readings often give a more accurate picture. If your numbers are consistently above 130/80, have a conversation with your doctor about what that means for your situation and what steps you should take. Diet plays a profound role in cardiac health at every age, but there is something particularly important about how we approach nutrition after 70. Sodium reduction is genuinely powerful for people with heart concerns. Excess salt causes fluid retention and raises blood pressure, contributing directly to the kinds of problems we've been discussing. This doesn't mean your food has to be flavorless. Herbs, spices, citrus, garlic, these can create extraordinary depth of flavor without a single grain of added salt. Explore them. Give your taste buds a few weeks to adjust, and you'll be amazed at how sensitive they become to the natural flavors in food. Focus on heart-protective foods with a kind of dedication. Fatty fish, salmon, mackerel, sardines, packed with omega-3 fatty acids that reduce inflammation and support heart rhythm stability. Leafy greens loaded with nitrates that support blood vessel function. Berries full of antioxidants that protect the cardiovascular system. Nuts, seeds, olive oil, avocado, healthy fats that support cholesterol balance and arterial health. Legumes, beans, lentils that provide soluble fiber to help pull cholesterol from the bloodstream. These are not exotic superfoods. They are real, accessible, affordable foods that your heart will thank you for. Movement matters too, and I want to be careful here because too many older adults hear exercise and think they need to be running marathons or going to the gym every day. That is absolutely not what I'm saying. What the heart needs is consistent, moderate, sustainable movement. A 30-minute walk 5 days a week has been shown in multiple studies to reduce cardiovascular risk significantly. Gentle swimming, water aerobics, light cycling, yoga, tai chi, any movement that gets your heart rate up slightly and keeps your body mobile is profoundly beneficial. The danger lies in inactivity. A sedentary lifestyle accelerates every single risk factor we've discussed. Blood pressure rises, blood sugar climbs, cholesterol balance shifts in the wrong direction, fluid regulation worsens, and the heart muscle itself becomes less efficient. Movement is medicine. It is not optional for a healthy heart. Find something you enjoy, something you can do consistently, and do it. Your heart is asking you to move. Sleep deserves a mention here that it rarely gets in heart health conversations. Poor sleep, particularly untreated sleep apnea, is strongly associated with hypertension, heart arrhythmias, and increased cardiac risk. Sleep apnea, where breathing repeatedly stops and starts during the night, is incredibly common in older adults and largely underdiagnosed. If you snore heavily, if your partner has noticed you stopping breathing during sleep, if you wake unrefreshed no matter how long you sleep, or if you experience morning headaches, please be evaluated for sleep apnea. A CPAP machine, used consistently, can genuinely transform cardiovascular risk in people with this condition. Stress management is not a luxury. It is cardiac medicine. Chronic stress elevates cortisol and adrenaline, raises blood pressure, promotes inflammation, disrupts sleep, and in susceptible people can trigger arrhythmias. The mind-heart connection is real, it is physiological, and it is powerful. Find your decompression method, whether it's meditation, prayer, time in nature, creative expression, gentle movement, or meaningful connection with loved ones, and protect that time like it's a doctor's appointment. Because in a very real sense, it is. And medications, please do not make changes to your cardiac medications without consulting your doctor. This cannot be overstated. Blood thinners, beta blockers, ACE inhibitors, diuretics. These medications are often keeping a delicate balance in place. Stopping them suddenly or changing doses without guidance can trigger exactly the kind of cardiac crisis they were prescribed to prevent. If you have concerns about side effects, if you feel your medication isn't working, if you can't afford your prescription, have that conversation openly with your doctor or pharmacist. There are almost always solutions, but silence and self-management in this area can be truly dangerous. I want to tell you something before we reach the end of this conversation, something I want you to carry with you long after this video is over. The heart is not just an organ, it is the rhythm of your life. Every beat is a moment of existence, a pulse of experience, a continuation of your story, and your story matters. The people in your life, your children, your grandchildren, your friends, your community, they need you in it. They need your wisdom, your laughter, your presence. You have spent 70 or more years accumulating a kind of irreplaceable knowledge about life, about what matters, about how to weather difficulty, about what love and loss and joy and time really look like up close. That knowledge is precious. Your heart has carried you through all of it. Now it's time to carry your heart. The 5 signs we talked about today, that deep, persistent fatigue, that breathlessness that comes too easily, that swelling in your legs and ankles, those irregular heartbeats and palpitations, and that dizziness when you stand, these are your heart's voice. It is speaking to you in the only language it has. And the most important thing you can do is learn to listen. Don't let embarrassment stop you. Don't let the fear of making a fuss stop you. Don't let the assumption that this is just aging stop you. You deserve to have your symptoms evaluated. You deserve to know what is happening inside your own body. You deserve early diagnosis, proper treatment, and the best possible chance at a long, vibrant, engaged life. Heart disease does not have to be a death sentence. Caught early, managed well, supported by the right habits and the right medical care, it is something that millions of people live with successfully for decades. The key word is early, and early detection requires awareness. That's what today was about. That's what this conversation was for. So here's what I'm asking of you. If anything I've described today sounds familiar, if you recognized yourself or someone you love in these signs, please make that phone call tomorrow. Schedule that appointment. Don't put it off for next week or next month. Your heart has been patient. You've had these signs for a while. The conversation with your doctor cannot wait. And if you're watching this and everything I described sounds like someone you know, a parent, a spouse, a neighbor, a friend, be the person who speaks up. Be the one who says, I saw something the other day and I just want to share it with you because I care about you. Sometimes we need someone else to validate what we've been feeling, to give us permission to take ourselves seriously. You could be that person for someone today. Your heart has beaten for you every single moment of your life. Through every joy, every sorrow, every ordinary Tuesday, and every extraordinary milestone. It has never taken a day off. It has never asked anything of you except the chance to keep going. Today, you have the chance to give it exactly that. You have the knowledge, you have the power, and you have every reason in the world to use both. Take care of your heart, because your heart takes care of everything else.